Hi everyone, my name's Andrew Darley and I'm a postdoctoral researcher at University College Dublin. Today I want to speak about the ValueCare project and more specifically my experience of co-designing integrated value-based eHealth technology for older people living with frailty in Ireland. The ValueCare project is a European project and in Ireland it's been led by Professor Anya Carroll. I'm the postdoctoral researcher and Aveen Murray is the project manager. So just to give you a whistle-stop tour of the ValueCare project, it's an EU project. It was established or launched in 2019, and it was a 4-year project, but it's now been extended to a 4.5-year project thanks to COVID. It has a multidisciplinary consortium with 17 partners across 8 countries, and these include stakeholders from health and social care backgrounds, from academics to clinicians to researchers, to IT developers and age advocacy groups. So I suppose the impetus for this project was that we know people are living longer. We want to support people live well, but we also know that the older people get, the more at risk they are at developing health conditions. So we wanted to rethink how we deliver healthcare to older people and how best to do it digitally. So more locally in Ireland, ValueCare has been appointed as one of the HSE's or the Health Service Executives Digital Health Living Labs. So these are just an overview of the consortium. We're very lucky to have such a creative and collaborative environment in which to undertake this project. So we are the lead on the Irish pilot site. So I suppose the key objectives and aims is to develop an outcome-based integrated care for older people to improve their quality of life and of their family caregivers. We want to provide a secure and scalable, robust digital solution for integrated care and also contribute to the sustainability of health and social care systems in Europe, because we know that the longer people live, the more health conditions people will develop and the more stress that will be put on the healthcare system. So we want to support healthcare systems being able to provide the care to older people. And also we're adopting the triple aim for healthcare improvement with the addition of physician experience. So we want to also improve staff experience in giving care to older people. So in Ireland, we want to co-design eHealth technology to support people over the age of 75 with mild to moderate frailty to live well and independently in their home setting. And then this technology will be later piloted in Cork and Kerry. And we've worked very closely with the integrated care program for older people to identify which condition we should look at and also where the entry point of the technology should be in the community in Cork and Kerry. So in order to design the technology, we knew we wanted to talk to people. We didn't want to prescribe what we thought people want. We wanted to ask them what people actually wanted. And we went in with that kind of motto that technology, there's been so much technology that technology can tell us what can be done, but we wanted people to tell us what should be done. So co-design is all about working with the community as active participants in the design process to create a shared value of what the technology would be. And in this case, it involves older people, family caregivers, health and social care professionals, and managers as well. And this technology will later be implemented in Cork and Kerry in November 2021 as a large-scale controlled pilot with 240 older people and their family caregivers. So just moving on, and this is what I want to specifically focus on today, is our experience of co-designing with older people, particularly in an online setting. So co-design seeks to collaborate and capture the lived experience of older people, caregivers, and health and social care professionals. We didn't want to assume what people assume what the problems people had. We want to ask them what problems they had and then design the technology solution around that and avoid prescribing and focus on the service that people actually want. So a key step in this was the stakeholder mapping. The research team in Ireland is based in Dublin, but our participant group is down in Cork and Kerry. So we knew this is we knew we needed to get like an on the ground understanding of who the key people are, both in terms of the clinicians, but also where the best place to access older people and the caregivers in the community. So for older people, we engage with Age Friendly Ireland, who are a national programme that support older people. We worked with the Community Workers Network, which is fantastic, and engaging with local initiatives. We've also been engaged with Friendly Call Cork and Men's Sheds, which is a mental health organisation, and also daycare centres where older people attend, and as well as their family caregivers. And we've worked with the integrated care programme for older people to identify key clinicians in the area as well. So despite COVID-19, co-design data collection commenced in November 2020. I don't know what research project wasn't affected by COVID last year, but we did experience some challenges. As I said, the research team is based up in Dublin and our participants are down in Cork and Kerry. So we knew this had to be in an online environment because we couldn't physically travel down. And even when we tried to establish a group that could meet together in Cork and we could teleconference in, the COVID restrictions were ramped up and it wasn't safe or feasible to do it, especially with our cohort with our over 75. Also, from a family caregiver perspective, we know that family caregivers are often overlooked in research. But when we actually approached family caregivers, there's actually been a saturation of family caregiver researchers, which is great, but it made it a challenge for us. So we wanted to make this interactive and as inclusive as possible, because co-design typically is done in a room. You'll bring people together, you'll brainstorm, you'll have post-its, you put notes up on the board and you talk things out as a group, but that just wasn't possible to do because of COVID. So it had to be a blend of online methods and telephone calls. So I suppose what I wanted to share today is a few tips on how to actually co-design with people in an online setting, and also more generally, not even co-design, but just to do focus groups with older people online. So I suppose gatekeepers were really essential for this project. In accessing older people. They were the ones who brought the study to the people in Cork and Kerry, and they gave an initial explanation of the study, who were then referred on to us then if the older people were interested. Another key thing was the term frailty is not a well-received word amongst older people. They don't like it. They don't identify it. There's a negative stigma attached to it. So instead we use more positive words. So challenges and activities of daily living, and give examples of walking, shopping and cleaning, or like typical activities that somebody with frailty might have. And people did respond to that more. So when somebody was interested in the study, we did have one of the researchers did have an initial conversation to explain the study and build rapport before actually taking part in an online focus group. And it just, because we're not meeting physically, it meant they got a better understanding of what we were trying to do. And also some people had never taken part in research, so it just even broke down that barrier as well. So in terms of actually setting up the video call or the Zoom call, we offered to help set up the test session, but not only that, we also help people download Zoom and get it set up on their computer so they had it. And we did this by having a telephone call with somebody and then them on their laptop and just guiding them step by step through it. But we also designed a one-pager explainer of how to set up the platform, and with Zoom screen grabs, and we'd sent that by either email or post if they didn't have Microsoft Word on their computer. I suppose another key thing is that we send the questions to the older people and caregivers beforehand, so they had an understanding of what types of questions they're going to be asked. Health can be very sensitive to people, and as we're all immersed in health research, we may become desensitized. So it was important that people understand what they were going to be asked, especially if you're going to be sharing it in a group setting. And we also took the decision that we were going to have smaller groups of 3 to 4 people. We felt that on an online setting, if they hadn't taken part in a focus group before, it might be a bit intimidating for them to talk in a larger group. So during the session, icebreakers were really important. They hadn't met each other in person and we hadn't met them either. So in the beginning, we did have a chat about COVID, and we did also talk about how things were in Cork and Kerry and things that they enjoyed. When asking questions as well, we gave them time to consider each question. We didn't expect a response straight away. We gave, a couple of minutes for them to have a think about it, and also encourage discussion between each other as you would in a normal focus group. And we also allowed a window before the session for any technical issues. So even though this focus group might have started at 20 past 10, the actual Zoom session was open from 10 o'clock that they could log in. That extra 20 minutes, and it took the pressure off them as well to feel like they had to be ready. And also, we didn't want to exclude anyone who had never used technology. So we did give the option of having standard one-to-one interviews by phone, because we felt that we didn't want to be exclusionary, and we felt that people who had never used technology before, didn't have access to it, may want to use it now, and we wanted them to be part of this co-design process as well going forward. And also, we did ask them if they could get assistance, if they really found it difficult, to get assistance from a family member or friend to help them set it up. So just also from a clinician side, when we were doing the co-design with clinicians, we had an introductory stakeholder meeting with managers, for them to introduce the study, but also for them to identify who on the ground would be most appropriate for taking part in the group. We used an online platform called AHA Slides, and that was really helpful in actually kind of recreating the co-design kind of experience. We were able to do word clouds. We asked questions like, when you hear the word value, what words come to mind in terms of older people living with frailty? And we're also able to use open-ended questions where people could answer the question anonymously amongst their peers, and then we could talk it out as a group. And we also did one-to-one interviews with clinicians, because we're mindful of their clinical hours and redeployment and the conditions we were working on in COVID. And then also we asked clinicians if there are any other individuals, clinicians that they work with, who they think would be really important to take part in the co-design process, so that they were experiences of co-designing with older people and also clinicians. And the co-design process is still ongoing. So we'll be able to share the findings later in the year. So I suppose in conclusion, the aim of the ValueCare project is to support people put people at the center of their care by establishing their needs first and preferences, and then designing technology around that to meet those needs in Ireland and in Europe with other health conditions. In Ireland, we're specifically looking at the condition of frailty. COVID has been a challenge for the research, but it's also been a driver for the appetite for technology amongst older people. So many people said to me that before COVID, I'd never considered going near the internet or going near a smartphone, but because of COVID, they're more open to it. And I'm not saying that this maybe ValueCare was a good time because of COVID, but we feel it's the right time, because COVID has been a vehicle in getting people more open to the idea of using technology in their care. And finally, the point I really want to ram home is that co-design with older adults in an online environment is possible. One participant did joke with me in one of the sessions, and I pulled a short straw doing a technology study with older people online in an online setting. She said, "You'll never get it done," but we have been able to do it, and it has been really effective. And the data that I've gotten has been really rich, and we feel we have captured that lived experience through online methods. But that has only been through having the preparatory work done, and also building that rapport with people before the sessions. So that's basically everything, the tips. So if anyone has any questions, I'd be happy to take them. And also I'd like to just give a mention to our local steering group in Ireland, who is comprised of the Integrated Care Programme for Older People, the HSE Digital Transformation, also Aid Friendly Ireland, and University College Cork. So I'd like to thank them as well for all their help and support with running this project. Okay, thanks a million.